The work that we do in our unit is based around trying to get a more rigorous approach to capacity strengthening, to planning it, implementing it, tracking it, measuring its impact. And the reason for that is that there's been an accelerating interest in capacity strengthening over the last few years, but the evidence about how you do it effectively is very scarce. And there's a big risk of reinventing the wheel, people making the same mistakes again, and then you don't get such good value for money and people don't really learn how to do it more effectively. So we came together to try and see what we could do to try and improve the rigour and the systematic way that capacity strengthening could be done. It's very much about institutions and individuals being able to become autonomous in research, to become research leaders, to become centres of research excellence, able to pick and choose their own partners, to apply for grants, to produce international standard research, and obviously focusing on low and middle income countries. That's where all of our work is focused. We need a big pool of different disciplines within the team to be able to address this very complex intervention. So, for example, we have social scientists, we have laboratory systems experts, educational developer, health systems people. So we need to be able to mix and match the skills that we've got in the unit. In terms of other partners, we've worked quite closely with the University of Toronto and Manchester Business School on some of the theoretical aspects of capacity strengthening, particularly trying to get together the state-of-the-art, collecting all the information from the current literature and synthesising it and publishing it so that we can be confident we really are at the leading edge of what we do. And then in terms of practical applications, most of the work that we do is actually working with partners in low and middle income countries, particularly Africa, but also other places, to actually help them develop capacity, to plan it, and to actually have ownership of it. So in almost all the projects we work in, after a couple of years, we can really back right off. It takes a couple of years for people to get the idea and to really start making decisions themselves about it. But after a couple of years, we can really just back right off. And maybe we might, in some of these projects, it's really interesting to know how changes have come about and how they've been sustained. So we might have a sort of light touch phone call every quarter or Skype every so often just to see what's going on. But it's not that we've, it's very much owned and run by the people on the ground. So one of the things that we really try and persuade people to do if we can get into projects very early is to define the goal, and then we can do some research around, if you want to achieve that goal, what capacity do you need to achieve it? And we get that information from the literature, from talking to experts, from looking at the project documents or log frames or theory of change or whatever they've signed up to in their project. Then we take all of that on board, but also do a big literature search to try and decide what it is that they need to achieve the capacity they want to achieve. And then once we've got that, we use that as a sort of benchmark against which to then go in and do a needs assessment. In terms of our approach, we collected evidence from the literature, from experts, and we've refined this approach into 5 key steps, which are steps that we follow in all our projects, to a greater or lesser extent depending on the project, but we always follow that process, and that has really helped us be much more rigorous about it. And it also means that other people can come on board and we can show them the way to do this, and then they can take it away and, with some support initially, do it themselves. There is a lot of research needed. This is very under-researched area. We do have a community of people who are also researching in this area, but it's just a handful of people internationally. So there's a need for more people to look on this as a researchable topic and generate the evidence and share it. So I think just in general about capacity strengthening is for people to approach it in a much more systematic way.